My practice is really very interesting because it includes a combination of approaches to diagnose as well as treat people with acute and chronic musculoskeletal conditions. So as part of the Center for Spine Health at University Orthopedics, one of my primary roles is to help diagnose patients. Patients often have conditions that are being either misdiagnosed or not diagnosed at all, treated on their own. And when they come to our office, the first thing that we really try to do is to use our ears to listen to them tell their story, our eyes to see whether they're having any obvious areas of trouble, and our hands to really move joints, move the spine, and to help figure out the cause of their trouble. I often tell my patients that symptoms are like the flames of a fire. But before we can use the fire extinguisher, we need to figure out where the cause is, where it's coming from. And so many of our patients have been just trying to treat things without understanding the underlying foundation of the cause of their trouble. The other thing that we do is we help provide a lot of conservative care that may include anything as simple as helping people change the way they do repetitive motions, whether it's in a sport, whether it's their posture, whether it's how they do things at work, or to give them exercises to recover from an injury. Or we may provide things like manipulation to help relieve tension in tissue or improve motion in joints. These are some simple things we do for patients. Oftentimes we add to that things like medications or injections to help relieve symptoms. Regenerative medicine offers an opportunity to actually restore not only function, but to improve the structure of anatomy, whether in joints or the spine. Pain in and of itself can be very disabling, and when people have pain coupled with trouble moving or trouble with activities of daily living, such as dressing themselves or even going to work, it becomes very disheartening for patients. And many of them have a lot of fear, and part of the reason that they don't go to a doctor is they're afraid that something very bad is happening. So one of our roles is to help them understand their cause of their trouble, and also to offer them options for managing their trouble. And so working as a team with physical therapists, with the part of our practice that does bracing, with the physicians in our practice that do conservative treatment, with our physician assistants, with the surgical team, all of these things offer patients more options. And what we tend to find is that patients are looking not only for answers to what's wrong with them, but they're also looking for options. They're afraid to go to the physician and find out they only have one choice. So it's usually much better for the patient if we make decisions together. I like being out on the water. I like fishing. I have 2 dogs and a cat at home aside from my wife, so I like having family time and relaxing. I've traveled around the world a lot, so I can really interact with patients and enjoy my time with them. So it helps me not just be sort of the doctor behind the desk, but rather just a regular person out there doing my thing.